This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everybody. This is going to be a learning experience for all of us, and learning about a system within our body that is so critical, so important, but many of us not even sure what it does. We may not even have heard of it. It's so important, and there's actually massage to support that system. I am referring to the lymphatic system in our bodies. She harnesses the knowledge that we need for that, and also massage therapy. And so great to have her join us today. Ann Boone is on the program. How are you doing today?
I'm doing great, Steve. I'm so happy to be here with you. I'm honored. And I've actually listened, once I knew I was coming on here last fall, I started listening to your ripple effect. And so kind of getting to know you a little bit that way, but I'm really honored to be here today.
Oh, great to have you here. And the lymphatic system, as I found out a few years ago, I was one of those people, had no idea. You know, the only word that we probably would know is lymph node. As kids, you go to the doctor. What's one of the first things they do when you're sick? They check your glands. Sure. All right, that's your lymph nodes, one of the biggest ones in your body. However, as I understand it, and please correct me as we go along here, we have hundreds of lymph nodes in our body, and they're so essential to flush out the toxins within. But we don't even look at it. We're not even aware of what's going on there, right?
Well, it's one of the many systems that just should normally work in a way that we don't even have to pay attention to it. So when something does go wrong, you usually know it because you'll have swelling. As you mentioned, you go to the doctor if you have strep throat or you have an infection. We'll notice it here right under our jawline. But it is such an essential piece of our physiology. So
yeah, and here's the part that I see is misunderstood. I spoke with a woman a couple of years ago who was writing a book about the lymphatic system. She was looking for very detailed pictures and drawings. Even in these times of technology, there wasn't a lot and isn't a lot out there. She actually used drawings from hundreds of years ago that they did that were fabulous. Pretty amazing.
Wow.
Yeah. Just not a lot
I
out
have
there.
right behind me here, I have a really nice little drawing. I have a lot of posters and a lot of things I use to educate my clients with. So but it can be a misunderstood and or not very well known system. So
tell us more about it. What's actually going on there? And the fact too, this is the mind blow for me, and it's pretty obvious, but we don't consider it. The heart pumps blood in our bodies. We all know that. There's no pump for the lymphatic system.
That's correct. And there's no pump for the venous system. So arteries pump blood away from our heart and veins bring blood back to our heart, but they depend on valves. So you've heard of people having varicose veins?
Yeah.
Those are caused, the valves should just be one way. So say in your calves, you have these valves that the blood is just going up one way back to your heart. But when you stand a lot and maybe you're not wearing compression hose, those valves fail and you have blood pool, and that's where a varicose vein comes from. So both the venous system and the lymphatic system don't have muscles of their own. And the primary purpose of the lymphatic system, or two primary purposes, are, and I don't like to use the word toxin as much as I like to use the word metabolic waste, because most people don't have toxins in their body unless they've had chemo, they've had a snake bite. I think it's a very overused word. And as an ethics teacher and a kinesiology teacher as well at a massage school, we're kind of getting away from those terms and looking at more. So going back to the venous system. So we have blood that pumps away from our heart, feeding all of our body with nutrients and oxygen. And then some of that coming back to the heart through the venous system will leak out some of the stuff that it needs to feed the system. And then some of those things are metabolic waste, fat and fat-soluble vitamins, oxygen, those types of things are taken up. And then whatever is not used, the lymphatic system is sort of the maintenance people coming in and taking everything out. And we produce about 20 liters of blood a day, and then about 13 liters is taken back up, 17 liters is taken back up. So there are 3 liters that are just hanging around of fluid. So when it goes from the venous system, it's blood. And when it comes into the lymphatic system, it becomes lymph fluid. And the different parts of the lymphatic system include not only the nodes that we find in armpits and our inguinal area, kind of the groin area, but also our bone marrow, our thymus, which is right behind our breastbone, and that gets smaller as we get older. But as a child, we have pretty large ones. We also have the spleen is a lymphoid tissue, the adenoids and tonsils. So all of these are part of the lymphatic system. And when the venous system pushes these fluids out, and if it becomes too much of a load, the lymphatic system takes it back up and brings it back through the vessels. We have 2 main areas here above our clavicles, and they come back into this is the thoracic duct, and this is the right subclavian area, or the right lymphatic duct. So everything circulates through the body, comes back here, goes back to the heart, and it repeats that process again. If the load is too big, as far as what the venous system is putting off and what the lymphatic system can take up, then we have an excess of fluid. Then that's when you're starting to see swollen ankles, swollen hands, just a feeling of heaviness, maybe even some swollen abdomen. So that's one part of the lymphatic system, is sort of the picking up the garbage and taking out the garbage. The other part, and this happens in the nodes, is that that is part of our, again, with all the lymphoid tissues I just spoke about, that's part of our immune system. So once it kind of takes everything out that it doesn't need, and it kind of looks in there and says, okay, any infection going on, anything else going on. And then we have T cells and B cells and all of these parts of our immune system, white blood cells, those are all white blood cells, that eat up all the bacteria, viruses, fungus, anything that might be in our body that is causing us to not have optimal health. So we have the immune system part of it, and we have the kind of taking out the garbage part of it.
Thank you for explaining that. And I am one of those people, even knowing a little bit about this, I would say toxins, that we have toxins in our body. But
everybody says that.
Yeah.
And even the training says that. I'm getting ready to take 135-hour training in lymphedema, which is a little bit more involved with people who've had lymph nodes taken out and those types of things. So even they talk about toxins, but and obviously if something builds up too much in our body, ammonia, lactic acid is not a toxin. It's something that's put back into the system.
Sure.
But there are certain things that can build up in the system that can become toxic. But I think that's an overused word. And I find this a lot with massage therapy, yoga. You can even get on Cleveland Clinic website and those types of things, and they still talk about toxins. But it's starting to become a term that we're learning more about what is actually a toxin and when to use the word metabolic waste.
I love it. And
yeah,
when we visit the bathroom, we're getting rid of waste. So
that's right. Yeah.
Different type of waste that, when it comes to draining our system, and there's probably some parallels there as well.
Well, and you bring up the little piece that I didn't get to is when it goes into the bloodstream and continues that process, it also goes through our kidneys and our liver, the lymphatic tissue, the lymphatic waste products. So we urinate it out. A little bit of it we breathe out, and a little bit we sweat out, but most of it we urinate.
So
get rid of it.
I had a few years ago lymphatic drainage massage, and part of that was I had some minor surgery here and there, and I was thinking that maybe this is the right thing to do. To my surprise, and you just say the word massage right away, anybody's like, yes, I'm on board, let's go. It's such a light touch. And the rest of us, and I included in that before that experience was, I'm paying for a massage. dig in, give me what you got. Deep tissue, go deep, whatever. No, it's amazing what can be achieved with such a light touch, right?
Well, absolutely. And most of the lymphatic system, Steve, is below the surface of the skin. So it's right between the skin and your muscle. And this is where the blood capillaries and the lymph capillaries kind of have a little party in there. And they're hanging out, waiting for each other to, okay, you're getting rid of fluid. I'm going to take that fluid up. If the practitioner, and there are a lot of people doing this improperly. In my practice with my two other therapists who are also certified in manual lymphatic drainage, we see a lot of people post-op, knee replacements, hip replacements. I see a lot of women who've had mastectomies and reconstruction. We see a lot of post-cosmetic. And with the post-op cosmetic, especially people coming from Miami, there are a lot of people who are not properly trained and they're hurting people. They're telling people, they're almost passing out. They're doing it so hard, and they're telling them it's normal. So we have to re-educate them. But it is a very light, the whole point, if you think of the lymph capillaries going this way, what I want to do is I want to stretch them this way and then send the lymph that way. Stretch, send, just like a little pathway. I use the analogy, if I'm going to, I live in Lexington, Kentucky, and Cincinnati is an hour north. So I tell my clients, so if I want to drive up to Cincinnati, I want to get my lymph up there, I'm going to clear the road from Cincinnati down to Lexington to create a vacuum, and then I can send the cars up. So that's why we would work in these areas first, the areas where the main drainage points where nodes are. It creates a vacuum, creates an empty space, and then we can easily send that lymphatic fluid back to where it needs to go, and the body actually starts to work. And it lasts, the working of the lymphatic system keeps going after we've stimulated it. You can also stimulate it by being on vibration plates, rebounders, little bouncy things, walking, exercise, these types of things. So that's the way that you can stimulate it. But it is a hugely important system. And we work with a lot of people with autoimmune diseases as well. And so the lymphatic system is working really hard all the time in a anti-inflammatory and sort of a sentinel type of role to try to help that person. So they have a lymphatic system that is often overburdened.
This is further proof why movement, exercise, any kind of movement is so critical to keep the fluid moving. Now, let's take a look at, geriatric patients or geriatric people in general. They don't move like they used to. So I got to believe that's a big challenge with that fluid building up.
Well, it can, and water intake is really important as well. Yes, I work with, my oldest client is 103.
Wow.
She's been with me for almost 35 years.
Oh my gosh.
And she actually comes to me, and she used to drive before the pandemic and work at a local grocery store, but she can't hear. She doesn't need to be driving, but she's sharp as a tack. And I've gone from regular massage with her years ago. Now I just do craniosacral therapy and a lot of lymphatic drainage with her. And she's had some heart issues. She has a pacemaker. So especially as we age, the vascular system can become less flexible. It's really important for your arterial system to have flexibility because it has muscles that cause pressure. If you cut an artery, it's going to spurt like that. The venous system won't do that. So you want those arteries to stay nice and flexible. And when you have heart issues, diabetes is one that really breaks down the cell wall inside the vascular system. So this is why people have issues with their heart, with their liver, with their kidneys, with peripheral, arms and hands and feet. We hear the word neuropathy. So nerve, pathy, issue or a pathology. So yes, with older people now, having said that, and even with younger people who have complicated medical conditions, one has to be very careful how we titrate the amount of lymphatic drainage we give them at first. Like, as you mentioned, Steve, it doesn't seem like we're doing much, but I always tell people get off the table very slowly because you can be very dizzy and those types of things. So because we don't want to create too much movement in the lymphatic system if the heart's not working properly, if you have congestive heart failure, these types of things. So there are some contraindications to this work. Is
it possible to eradicate too much lymphatic fluid in a patient?
Yeah, as I just mentioned, if a person doesn't have the capacity, they can't take that load on their heart, then, and also if somebody is on diuretics, we have to be careful. It's actually technically prescribing for us to say, drink more water. And I tell my students all the time, if you're not going to tell somebody to drink more water who's on a diuretic,
right?
Because then they're going to require more diuretics. So we have to take into account all of the medications they're taking. We have to take into account any of their medical history. At my practice in particular, we're a little unusual in that normally, I think probably, Steve, when you've gone to get a massage, they might talk to you for 5 minutes, get on the table, face up, face down, however they want you. The very first time we see somebody, it is a half hour to 45 minutes, and sometimes I've spent even longer taking a medical history, health history, injuries, surgeries, motor vehicle accidents, just to get a good idea of the complexion of this person's body and how they might have come to get here, as far as lymphatic and just muscular, everything.
That's the difference in terms of more holistic healing. Because you look at, and not putting any doctors under the bus, no. However, in today's world, you go to your primary care physician, even some specialists, it's about 11 minutes on average that you have in there. That includes the hello and goodbye. They're not getting your story, so therefore, they're going to do what they can do, and that's treat the symptoms, not going to the root cause. So refreshing to hear, Ann, that you spend that time with patients. You got to.
Well, I have that time, and I have clients who are physicians, and we talk about that a lot. They tell me they have between 5 and 7 minutes if they work for a corporate entity.
Yes.
That's how long they have in it, and it is really a problem with the medical system right now. This is why you have doctors going to concierge treatment,
yep.
and not practicing, because they're getting burnout, and it really opens them up to having medical mistakes, which is not a good idea. So, and it's not putting the medical profession down. They have way more training than I do. And I tell my students, you are the only ones who are muscle specialists. There's no doctor who's a muscle specialist. You have orthopedics, bones, you have neurologist, you have all these other systems that people look at. A physiatrist who's a rehab doctor might be the closest to that. But I think this helps my massage students because they think when they get out, what if I'm treating a doctor, he knows so much more than me? He won't know as much about the muscular system as you do. Or the lymphatic system. We have to convince some of our post-op doctors or cosmetic and even orthopedic doctors that, that this can actually help the person heal quicker and make your work look better.
Amazing. I love your passion, and amazing.
Oh, I love it. My husband retired last year, and he said, "Are you going to retire?" I said, "When I can't do this anymore, or I don't like doing it anymore." So I have a dear friend's mother who's 85, and she's still practicing, and she's in great shape and loving it. And so at 65, I don't see myself slowing down at all.
Amazing. Where did this all begin for you? Your affinity for helping people like this?
When I was about 10, I was introduced, my best friend's mother and her mother, her grandmother, were very into complementary and integrative medicine. We called it alternative medicine now. We're trying to get away from that term.
I remember that term. That's so interesting.
Yeah, alternative. So they used to call it complementary and alternative medicine. So now in our field, kind of like with toxins, we're trying to get away from that as we want to be and allopathic and complementary and integrative other than just alternative. So we want to create a marriage with the traditional Western model. So at 10 years old, I grew up in California, and a lot of things have been out there for much longer. We've, the land of nuts and fruits is what they call us all the time. So my friend's mother was very into Ayurvedic, macrobiotic, all kinds of different types of diets. So first I started with really being interested in that type of thing. Every weekend, we had the first health food store in the area in 1970, and my mom, I would have her take me there almost every weekend. I was this little geeky health nut kid. And then I was a dancer when I was younger, from the time I was 4 until I was 18, and gymnastics. And when I was about 10, I started being with horses. When I was 19, I started working with racehorses, and I started dabbling in massage therapy. And I loved what it did for me, because through my high school years, I had acupuncture and massage therapy, which helped me with my injuries. So for years, I did massage part-time, and I worked with racehorses from about 79 until 94, galloping racehorses, exercising them and breaking yearlings, and working with sales yearlings in California, France, New York. And I met my husband in California at a horse sale 42 years ago almost. And that's how I came to be here. His family had a horse farm, which he just retired from.
Wow. It's interesting. Movement has always been in your life, from the dancing aspect, right?
My mom was smart. We were like, my brother and I were like two Weimaraners in the house, so she got us into all sorts of activities. We were, now you have kids who I was talking to somebody the other day, how they would be punished in high school. And they said, well, we'd have all our electronics taken away and we'd be kicked outside. We'd be kept inside because we were just outside all day long. So I'm very fortunate to have had movement in my life, for sure.
Have to tell you, the horse thing, I was away this past summer. I call it the Steve Retreat. I just started doing it this year, where I just rest, relaxation, reflection, went to an island, super cheap, just stared at the ocean, but there was a horse in a field next to where I was staying. And it was just tied up there, very sad. Like, they just leave them there, part of a tour, didn't need the horse that day. So I would go over there, give the horse water. It's warm, it's hot. Some lettuce, whatever I had, I could feed. But I have to tell you, and looking in that horse's eyes, I got it. Why these are such intelligent, intuitive, amazing animals. We look at them as service animals, but there's so much more going on there. And I actually feel the need to go to a stable and just, be near a horse. I don't have to ride it. I just got to be near it. And I'm feeling that you might know what I'm talking about.
Well, there are therapies called hippotherapy. And actually, my son, who had Asperger's, when he was in middle school, because he had grown up around horses as well, I took him to do some therapy with horses, which helped his confidence, just helped a lot of different things about being on the spectrum. And it's also very, very beneficial for people who had trauma and abuse situations. They actually have hippotherapy so that people can start to trust another being again, really connect with another being in a very non-reciprocal way, or
Sure.
a reciprocal way even. And like you say, just looking in their eyes, is really therapeutic.
Equine therapy, been around for a long time.
Yeah.
Now I truly understand why there are breakthroughs when people have challenges and they're just in the presence of a horse.
That's right.
We digress, but it's all part of your life and everything.
They have lymphatic systems too.
That's funny. How do we connect with you? What's the best way?
So you can go to BooneMassageTherapy.com. That's BooneMassageTherapy.com. Or you can contact me at 859-209, and I'm just making sure I give you the right number here, 209-90. Let's see here, I'm sorry. Here we go. All right. 859-308. I'm sorry, 859-209-9005. So that's 859-209-9005.
And once again, your website
is BooneMassageTherapy.com.
I've talked about massage therapy here before a number of times. Got to tell you, Ann, just amazing. Your insight, your passion, all of it. So much to talk about next time we get together. Appreciate you being here and looking forward to it.
Thank you so much. I'm looking forward to it as well, Steve.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.